So my name is Carrie Ann Hurst. I am one of the associate veterinarians here. Here at the Akron Zoo, we try to do yearly health exams on all of our penguins and most of our animals. At Mouse's yearly exam, we took x-rays, which is part of kind of the normal plan to just look at the insides and make sure everything looks okay. And we noticed a couple of things at her yearly exam. On her x-rays, we noticed that her outline of her heart and the outline of her liver were wider than they really should be. We also heard a heart murmur when we listened to her under anesthesia. And we also had noticed that she was a little bit thin when we kind of felt her body condition. It felt like she had less maybe muscle mass than she should have. It's not that uncommon that we hear heart murmurs in the penguins. Occasionally we will hear them, so several of the penguins have seen a cardiologist before, but there was a few other things that had us a little bit concerned that maybe what we were hearing on Mouse was not normal. So we took Mouse to one of the hospitals up in Cleveland. So it's a Metropolitan Veterinary Hospital. There's two locations. There's one in Copley and then there's one in Highland Heights on the east side of Cleveland. We went to the newer location, which is outside of Cleveland, because they had a specialized probe there that is meant to be used instead of a normal ultrasound where we would have the probe on the outside of the animal or the person. This probe actually goes down the throat into the esophagus, or basically like the tube that connects your mouth to your stomach. So they were able to do an ultrasound of her heart from inside of her body, which allowed us to get a better picture of the heart. We didn't have to contend with all of the feathers to see through that. And so Dr. Stoner was the cardiologist that helped us with that. Her and Dr. Hitchcock, they're both wonderful, but they had a lot of experience doing the esophageal ultrasound, so that's why we went there. When we got Mouse to the hospital outside of Cleveland, we gave her a little bit of sedations just to calm her down, and so that we could use less anesthesia gas, because we didn't know exactly what was the problem with her heart. And so you've got to be careful with these guys, putting them under anesthesia. That is something that's always a risk that we worry about. So she got a little bit of sedation, and then we put her under anesthesia. We had to insert a breathing tube basically to make sure that we could get oxygen to her, but also to protect her windpipe, since we were going to be putting an ultrasound probe down the esophagus, which is right next to the windpipe. We wanted to protect that airway. So that can be a little bit tricky in penguins in particular, because, well, number one, they're small, their windpipes are small, but they have a special adaptation in their windpipes that's different from other animals. They have actually a division that goes all the way down the windpipe and almost makes it so that they've got dual windpipes. And so that septum or that division is something that if you put the breathing tube in too far, you might only go in one side and not the other. So it can be a little bit tricky. But she went under anesthesia. She had her breathing tube in place, and then they were able to pass the esophageal probe for ultrasound to do the full scan of her heart. So with the transesophageal echo, which is what they did to evaluate her heart basically from inside of her body, they were able to see that the tricuspid valve, which is one of the valves on the right side of the heart, was leaking. We were seeing a lot of turbulent blood flow. The blood was going back and forth, which is not normal. That valve is supposed to shut and only let blood flow one direction into the heart, and we were seeing the blood go back and forth basically, and that's what was making the murmur sound when we listened to her, was that blood basically going the wrong direction. So we could see that the main problem was that valve is leaky. We were also seeing and kind of confirming there was fluid accumulated inside of her body where it shouldn't be, which basically confirmed that she was in right-sided heart failure, which is why she had been gaining weight and looking like her belly was swollen. So those were the two things that we noticed. What we don't know for sure is why that valve is leaky. Was she born like that? Was that something that, sometimes over time time as an animal gets older, the valve can just get a little bit more flexible than it's supposed to, and it can be more of like a degenerative change. We don't know. I don't think there's any way to know that, but that was what she was diagnosed with. It's not common in that there hasn't been a lot of these cases reported. There are reports out there of penguins having heart problems, but I don't know that particularly this valve has been reported as an issue in this particular species of penguins. The reports out there more commonly are the African penguins, which are our Humboldt penguins' kind of closest relative. So I do know even here we've had a couple of other penguins that have also had heart issues, but not this particular heart issue. Before she even went to the cardiologist, we had started her on a diuretic, or basically kind of like a water pill, and that basically helped her to drain the excess fluid that was building up in her belly. It helped her kidneys kind of flush that extra fluid out. So she started to lose weight and feel a little bit better before we went to the cardiologist. She's still taking that medication. Basically, that's just helping her to have less blood volume, and it takes away some of the extra work that the heart is doing over time. So she's still on that, and we wanted to keep her on that. We added another medication called pimobendin, or vetmedin is the trade name. It's a really common heart med used in dogs and sometimes in cats, but that is a medication that basically helps the heart muscle beat more efficiently, and it can kind of help to prevent damage to the heart muscle over time. So it's kind of protective, and it also helps the muscle function more efficiently. So she started on that recently. The third medication that she's on is called an ACE inhibitor, or enalapril, and that's another medication that basically just helps her body not to retain excess fluid, which over time can really make things harder for the heart to function appropriately. So that's where we are right now, basically keeping her on those three medications. She is going to be due for a recheck here soon, where we're going to check her blood, basically make sure her kidneys and her electrolytes are tolerating these new medications. We're going to be basically using her body weight and just how she is, clinically, how's she acting, how's her appetite, how does she feel. That's going to kind of gauge how she's doing. And so if we get to a point where she starts gaining weight again, or skipping meals, or not feeling good, then we know we may need to toy with her medications or get her back in for a recheck with the cardiologist.